Okay, lower back rehab. So I'm going to give you some movements, super simple, but once you get to grips with them and you start to get a bit more confident with them, you can start to expand them, build on them, and they're going to form the foundation that will be your stretching, your mobility, your prehab, your rehab, but in a few simple movements you can do anywhere. All I want you to do with these, if you're someone who's in pain right now, you've got a back injury and you're struggling, we need to do them in the morning or we need to do them at night. And that's it. And that should be enough to get you moving better. And then once you're more confident with them, I'll show you how to build on them. The first thing you're going to do, you're just going to breathe into here. So you're going to put your hands on your ribs here, expand, and then breathe out through your nose. So breathe in, push out, and then breathe out through your nose and give your bum a little squeeze. Do that 4 or 5 times. Move one. Next movement, all I want you to do is just forward and back like that. Nice and gentle, not loads of movement, particularly if you have just done an injury, particularly in a lot of pain. But that's it, I just want you to do that. Just back and forth. Just if it's just that, that's perfectly fine. Once you feel okay with it. So with this one, probably just do it for like 30 seconds aside, especially if you're only doing this, yeah? Then you can start to add in that. But to be honest, just put a song on, just chill, and just let everything flow. You know, so I'm going side to side, and go like that if I want as well. It's all about putting a little bit of movement back in. And again, that's just here because you're so bad. Don't worry about it. That's perfectly fine. That's all I want you to do. Once you're confident with it though, that's when we start to add the range and we up the demand and we change the directions. It's so simple. It goes from this to that. So it becomes, like I said, your rehab and your prehab. The next one, all you're going to do is you're going to squat down. So you're going to little squat down. That's all you can do because you're in pain. That's fine. What you might find is if you go up on your toes, you might find you can squat a little bit further. Opens up a little bit of range, get those stabilizers going. We're telling the body, chill, we've got this. You can let it go a little bit. But from here, this position, all I want you to do, that. So it's creating a little bit of space. That's it. So you're just going to squat down to where you're comfortable and you're going to move a little bit. So like we've just been doing, but we're just in that squat position. We've done a little bit of a hip hinge. The aim with that one, we want to get down here. We want to get moving like that. That's it. I know it seems simple, bit of breathing, but I promise you, you do these a couple of times a day, spend like 10 minutes on them, that within a few days you should be moving better. And then once you're at this stage, you should be feeling really good and ready to expand it and ready for movement.